So many people are struggling with depression and anxiety today. What are some of the techniques that you incorporate in therapy or that people can use outside of therapy to help with those issues?
So there's no one magical solution. There are a lot of different approaches to a lot of different problems, of course. But one of the most common approaches that I think has been promoted as kind of the gold standard for dealing with symptoms of depression and anxiety is cognitive behavioral therapy. And I will often incorporate that into my work with patients, though I also recognize that it has its limitations also. But it's extremely valuable to utilize those techniques in therapy, and for some people also outside of therapy. There are many available workbooks and self-help books that could be useful as well. And it's hard to encapsulate all of cognitive behavioral therapy in our brief video here, but I'll just give a quick, simplistic kind of explanation of it, is that it's addressing a lot of negative kinds of thoughts that people have that often happen automatically. People don't even realize very often that they're having some kind of thought that's a negative thought that leads to depression and anxiety. And when you're getting the person to pay attention to those automatic thoughts that kind of just pass in and out of a person's consciousness, but sometimes have a very big impact on the person. And when you get them to notice it, then that's step one. Step two then is then seeing the impact that it has on them. So the thought then leads to a feeling. And then step three is getting the person to learn alternative kinds of thoughts to help them combat those negative thoughts that are coming into their mind. And so when people start going through that process, when they see that there are many kinds of thoughts that pass in and out of their mind and that are having a very large impact on them, then they're able to kind of correct those thoughts, and it could lead to symptom reduction. Because most of those thoughts typically have some kind of distortion in them that pulls them away from reality and produces the symptom. So the cognitive behavioral therapy that we do will incorporate kind of expanded versions of what I just talked about. And some of that, hopefully, will encourage people who are watching this to go out and get some help, even with one of those kind of workbooks that I referred to before, and they could really help make a big difference for them.
And maybe we can post some of those workbook titles on our website as well.
Absolutely.